What's up, guys? Welcome back to Cherokee Hacks Life. So I've been getting a couple questions via comments and stuff, and I figured let me try to address them in a video because it seems like a pretty common question by quite a few people. Actually, there's several of them that seem to be pretty common, especially with all the emails that I'm getting. One of the big questions that I keep getting over and over again is, why am I back in the gym so soon after my surgery? A lot of people think that you should be, in a sling for like 4 to 8 weeks. Here, let me give you what I've researched, what I found out from my doctor, what I found out from my physical therapist, and what I've actually researched by calling around a couple other doctors in the Orlando area to see exactly what you should be looking for from a doctor, what you should be expecting, and each one is honestly going to give you something different. And here's why. The reason it all boils down to is picking a doctor that does the correct technique and isn't afraid to put you back into regular mode or regular normal routines of everyday life as quickly as possible. What do I mean by that? If you're going to go out and choose a doctor, choose the best doctor you can get with your insurance and the best doctor honestly you can afford. That's pretty obvious, right? What I would probably suggest beyond that is pick a doctor that they specialize in an area. Think of for example, my doctor, he specializes in 2 areas, shoulders and knees, because that's the 2 areas that most people playing sports injure, their knees and their shoulders. So with him specializing in those 2 areas, that's all he does, man. All day long, every single week, he's doing a surgery, either on the knee or he's doing it on the shoulder. That's his area. Find a doctor that specializes in the area that you want done. Probably one of the biggest things there. According to my physical therapist and several other physical therapists that I've talked to, my doctor, Craig Mincer, seems to be the one doctor that is, I wouldn't say the most aggressive, but the technique that he uses, he's so comfortable in doing it and has done it so often that the technique that he uses is perhaps one of the best that they have seen. And these are from people that have worked in this industry for quite some time. My physical therapist now, she's been working in this industry for probably about 2-3 years, so it hasn't been that long. Another one's been in it for about 14 years. Talked to her, she told me the exact same thing. And I remember back 3 years ago, there's one physical therapist that I talked to that she was in these, she was a physical therapist, no lie, for about 15 to 16 years, I think, at that time. So that's, hell, she's at 18 years now being a physical therapist. And she said, bar none, Craig Mincer is the doctor that she believes has one of the best techniques and is able to get people from labrum surgery right back out there as quickly as possible just from what he does and how good he is at it. By talking to other doctors, it seems like everyone uses a different technique, and I'm not going to go into the details and the minutia of what each technique is called or whatever, because again, I'm not going to pose to be a doctor. I'm just giving you guys the information that I have. But with each different technique comes a longer time in terms of healing and a longer time in terms of when you can actually go back into normal movements. Other doctors, and again, other doctors take the stance that they want to be a little bit more cautious with you getting back into activity. So if they leave you in a sling for like 4 weeks, follow what your doctor says. My doctor literally want me out of the sling the very next day. I'll use that thing for probably 24 to 48 hours. After that, I probably used it when I was just sleeping. And I would sleep on my back, put the sling on just because, honestly just because I had to. Because it felt more comfortable that way, and just put it on and then just fell asleep basically with one shoulder on my stomach. Some doctors just are a little bit more cautious than others. It's probably the easiest way I can say it. They want to keep you in the sling a little bit longer just to make sure that you heal. The problem is that when you do that, it's a longer recovery time afterwards. So the more you seize up your arm and the less you use it, just like any other joint, the harder it's going to be to actually get to that rotation that you want and get the the movements that you need to actually get back to. I mean, if you notice, I'm still kind of tight. So there's still areas like here, this is pretty tight as compared to here. I can pretty much just bring this all the way up without having to bring my chest up. So there's still areas that I need to work on, and I realize that. But if you keep your arm in a sling longer, it's basically going to take you a lot longer to actually come into full recovery. So keep that in mind when choosing a doctor. Ask them, how long am I going to be in there? How long am I going to have to be in the sling? You know, how many of these surgeries have you done? The best advice I could give you is choose a sports doctor, a sports orthopedic surgeon that's going to be able to go in there, know what he's done, know what he's doing, and picks a technique that gets you back out there as quickly as possible. Think about it from this perspective. A sports doctor deals with sports injuries. What you have is technically a sports injury. Labrum tear is pretty much a sports injury related injury. So if you're going to someone that actually specializes in shoulders and knees and is a sports doctor or a sports surgeon, then you probably chose the right person to actually go to. Think about that when you're going out there and looking for a doctor. Another big question I got, or that I keep getting, is what workouts was I able to do before the doctor cleared me? Now again, talk to your doctor about what you want to go through, but what I was able to do was light leg raises, and that was actually even a little difficult because you really can't stabilize yourself anywhere. So you kind of just try to hold on to the floor and try to do leg raises, and it was just weird. Like, you can still feel it. It's weird how some workouts still actually, you know, make your bicep move or flex, which causes the labrum to kind of, you know, feel like it's stretching again because you just finished coming out of surgery. Elliptical, probably one of the only things that I was able to do. Bike, and that's it in terms of cardio. Everything else, lay off until your doctor clears you. Again, my doc cleared me to go ahead and start working out after 8 weeks. He was like, do whatever the hell you want to do. He just wanted to make sure I start getting some motion in it before I start getting in there. But he was fine with me doing any leg workouts prior to that 8-week period. So I was doing leg workouts. I was doing, you know, lots of cardio. I was doing sit-ups. No walking, lunges or anything like that. No silly movements that's going to involve your arm is basically it. Don't do these movements, basically. In terms of what you should be eating or your diet, keep your diet at a maintenance level. If you don't know what your maintenance level is and you haven't had the surgery yet, or if you're going to have the surgery, or maybe you're having your surgery now, weigh yourself now. 6 weeks later, again, and in that 6-week time frame, or even 4 weeks if you have to shorten it up, within that 4-week period, only take in a certain amount of calories on a daily basis. Take in, say, 2,000 calories. For me, my maintenance level, doing my intermittent fasting, is 1,800 calories is my maintenance level. I don't gain, I don't lose. I've tested this out. That's what it is for me. If I'm going into a bulk, I go to 2,200, 2,400 calories if I have to. That's my bulk stage. I haven't really done a caloric deficit at all, but I would say it's probably around 1,600 calories, which is really easy to get to and actually pretty darn low. But 1,800 is my maintenance level. I don't gain, don't lose. Figure that one out for yourself. I can't tell you a magical number or what calculator to put in. The best way to figure it out is just by sitting down and doing it. If you have kids, and probably some of you do, you probably need to have the conversation with them that, look, daddy or mommy is not going to be able to play around with you for a couple weeks and pick you up and do stuff with you, tickle you, stuff like that. You won't be able to do that stuff with your kids. So it's going to suck for a little bit. But again, it's probably going to be about maybe 8 weeks before you're actually able to, you know, really play with your kids, because you don't want to injure yourself. That's what you want to try to avoid, re-injuring it, or really just causing yourself pain, because if the procedure was done properly, you probably won't re-injure it. But that's it, guys. That's pretty much all the advice I can give you on this. Again, choose the right doctor, ask them the right questions. I would focus on making sure that I get a orthopedic surgeon that's a sports doctor that specializes in the area that I'm actually going to be getting my work done. So again, my doctor is Craig Mincer. He works on shoulders and he works on knees. That's it. That's his area of expertise. He's good at it like that. In terms of diet, figure out a maintenance caloric intake. Stay at that maintenance caloric intake so that way you don't get fat while you're actually sitting around for a couple days or whatever and you're not actually able to do exercises. You won't get fat if you're at a caloric maintenance level. Just figure out what that is within a 4-week period. And then that's pretty much it, guys. If you guys have any other questions that you want me to address, please feel free to email me at cherokee@gmail.com, and I'll catch you guys on the next video. Talk to you later.